Hey guys, Nurse Alyssa here. Today we're going to talk about Aquacel Extra. So this is the Aquacel. It does not have any antimicrobial properties. So if you are looking for Aquacel AG, look in the description below and I will post a link for the Aquacel AG. So before we get started, if you could hit like and subscribe, it would be greatly appreciated. And let's get started. Aquacel Extra is created by two sheets of sodium carboxymethyl cellulose fibrous sheets. They're stitched together for a high absorbance and increased strength when saturated. So they are highly conformable to the wound base. So when it is saturated, it creates a gel pad, a soft gel pad that conforms to the wound. We're going to use the Aquacel Extra for moderate to heavy amounts of exudate. We can use this for drier wounds, but you would have to moisten the Aquacel with normal saline first before putting it onto the wound bed. We're not going to use this for patients who have either a sensitivity or an allergy to sodium or sodium carboxymethyl cellulose. So you're first going to prepare the wound base by cleaning it with normal saline, and you're also going to clean the peri-wound, getting rid of any debris that might be there, and then you're going to dry the peri-wound area. So then the Aquacel can be cut, but you want to make sure that it is overlapping the peri-wound by at least 1 centimeter. And if you're going to use multiple layers of the Aquacel, you're going to make sure each layer is out by 1 centimeter. So the first one will be covering the peri-wound by 1 centimeter. The next one will be covering the peri-wound by 2 centimeters. If you're using this as a packing, you want to make sure that you're only using one ribbon. So it does come in squares, so you'll kind of go around cutting it, making sure that you're only using one ribbon, and the ribbon does stick out by about 2 centimeters out of the wound for easy removal. To remove the Aquacel, you're going to use your forceps and gently remove it from the wound base. Now, if any gel is left in the wound base, just rinse it out with normal saline and it'll come right out. The frequency of the dressing change is every 7 days, depending on the amount of exudate coming from the wound. So it can be up to 7 days, but most of the time it's about every 2 to 3 days that we're changing a dressing. Just depends on how heavily it's exudating. The expectation of Aquacel is that it's managing the exudate coming out of the wound, and that there's no peri-wound maceration. So that's what we're looking for this to be a good choice for the wound. That's all I have for this video. I'll catch you next time.